As part of the Cervical Cancer-Free Initiative, we've actually developed what we've coined the Carolina Framework for Cervical Cancer Prevention. It actually has 4 pillars. The first is HPV vaccination. The second is screening among the unscreened. The third is actually trying to increase the sensitivity of current screening tests. And the fourth is to try to increase continuity of treatment. For example, the first pillar, HPV infection. If we could eliminate HPV high-risk type infection, which we can with current prophylactic vaccines that cover high-risk type 16 and 18, this actual provision of these prophylactic vaccines could prevent roughly 70% of invasive cervical cancer. This is important. However, screening needs to go hand in hand with vaccination because our current generation vaccines do not cover all HPV types that cause invasive cancer. So then looking at burden of mortality estimates, we know that 50% of all cervical cancer deaths are among women who have not been screened regularly in the last 4 years. We've really got to do more to increase screening coverage among the unscreened or not regularly screened. Let's not forget also that 1/3 of all cervical cancer deaths are among women who actually had a pap smear, but the diagnosis was missed. We can do more to increase the sensitivity of screening by incorporating new diagnostic tests for HPV. The last pillar is that there's a proportion of women who are not getting treatment after they've had an abnormal pap. We need to increase continuity of care all the way through to treatment in order to really make an impact on this disease. But we can do that by addressing the 4 pillars of cervical cancer prevention in the Carolina Framework. We can make a difference and we can prevent this highly preventable cancer. Let's end this cancer.